So empowering girls to complete and get a better education, to be more participatory in the workforce, to be more available and have the self-empowerment and the body knowledge, it's something that benefits all of society.
All right, welcome back to Heja Framtiden, the Swedish podcast on the future. Today I'm sitting here at my kitchen studio in Stockholm with Cristina Ljungberg and Wendy Anderson from The Case for Her. Welcome to the show.
Thank you very much.
Wow, you really are synchronized.
In most things we are.
Yes.
Yeah.
Great. And who wants to start making the case for her?
The Case for Her is a philanthropic investment portfolio. And it's really addressing three key areas of women's health. We invest in menstruation, sexual pleasure, and most recently, abortion access. So really, the really key women's health issues affecting half the planet that are massively underfunded. We started about a decade ago together as co-funders and really aligned with the understanding that we wanted our capital to be the most valuable capital possible. And so we do that by investing in areas where others don't. And we pride ourselves on being highly risk tolerant, fast, and flexible.
Nice pitch. All right. So Wendy, what is your background? How did you end up in this area?
I have actually a background in financial services. I worked for many years in a company that was building financial trading service providers to large exchanges. And so I worked on the trading floors and in the offices and built the systems of some of the world's leading exchanges. And I've seen the energy and the power of finance. And so now I'm in a position where I can use that to collaborate with others in the same space to kind of build the world that we would like to see.
Cristina, what made you dive into this particular topic? Why is women's health and girls' education such an important part of the future?
I have a background in biology and biotechnology. And I think it doesn't take long to realize that women's health is not only massively underfunded, but also under-researched. And again, just really wanting to dedicate some of my time and attention to addressing some of the world's largest inequities. When you think about, for instance, menstruation, if we're going to reach the SDGs, menstruation really hits a number of those, including poverty alleviation, health, education, gender equality, water and sanitation. I could probably keep going. So this is an opportunity to really have a catalytic impact across the SDGs.
Why do you think that this has been underfunded historically?
Stigma and taboo. It's an area that people aren't willing to address because they're hung up regarding women's sexuality. And they somehow tie menstruation to sexuality, even though it's a basic biological function.
So what kind of investments are you talking about when it comes to menstruation? Are there companies doing products in the area, or research in the area, or education, or all three of them?
All of that, actually. We've invested, but we actually deploy capital. And that's anything from grant funding and working capital loans to actually equity investments. And we started by strategically building our portfolio by learning from each opportunity to build the next one. So we did equity investments in a couple of product companies, a leading manufacturer in reusable pads called AfroPads, and a fashion-forward company called B-Girl. And that led us to understand the importance of education. So then we made grant funding to a leading researcher who was producing puberty books in education, and also led us to understand that the research in the area needed to be improved. So we'd done research and helped build some of the tools that are required to build the evidence that will help us to move the space forward. We also spent a lot of opportunity building collaborative networks and opportunities for the experts in the space to get together, because we really need to build the momentum. And then the last and biggest piece, I think, is in advocacy. We use our own voices and we use the voices of others in the space to really raise the importance of investment in menstruation.
I mean, our biggest focus is really getting more funding into the space to really enable scale capital to enter into these highly stigmatized key women's health issues. So we're asking ourselves, what are the gaps? What are the questions that we need to answer? So we've been investing in menstruation for over 10 years. Now we're taking the year to really reflect on what kind of evidence has come out of our personal investing. How can we package that and share that widely with the audiences that will start scaling the space? So an example would be the research that we funded for over 3 years in developing metrics. So metrics to measure the impact that investments are having in the space. With these metrics, we don't think that we need the metrics to measure, but the next follow-on funders will need to have the metrics to measure, to either report back to a government, a board.
Yeah, and we met briefly at Stockholm Impact Week a couple of weeks ago. But how do you balance between return on investment versus impact? Do you only look at the possible impact, or do you need your portfolio to grow as well?
We think we need both. For us, we're mostly interested in the impact in terms of the improvement in lives lived, but we know that we believe that we need to have the financial return on investment as well to attract some of the bigger money that might be available in this space. So because of the type of investing that we've done or capital we put into these organizations, we have actually access to both of those sides. We can see the impact from a human lives perspective. We can also see from a financial perspective what money in went to financial return.
And is it also that these companies, when you invest in them, they also get more access to other kinds of capital as well?
Absolutely. You can think of us as being that high-risk capital that moves first, and you can think of us as de-risking the space for the follow-on funding. And you can be using either philanthropic capital or early seed capital, all the way to venture capital. All of those instruments can be used to de-risk the space for larger scale funding.
Do you take an ownership, or do you just provide the capital?
We're extremely flexible intentionally. So obviously, making a philanthropic investment is an expected minus 100% return. We also move venture capital or equity funding. Really, it just depends on what is the best way to use funding or capital or investment to access the information, the experience, or evidence to move the space forward.
And can investors invest in your fund as well?
Absolutely not.
No, we don't take money.
We have no interest in managing anyone else's funding. And again, to just kind of get back to what we were talking about at the beginning, we really want to be the most valuable capital possible. And that includes being able to move fast and be flexible. So asking others for permission or reporting back to other investors, we're not interested.
What we want to do is provide the evidence so that others see the value in what we're doing. And then they also choose to enter the space of their own volition and for their own purposes. We don't have any interest at all in managing a fund.
Okay. Still frowning.
That would be so painful. Yeah. We're not good at asking permission.
We like
We're
investing
really
in
not.
other people's funds.
Yeah. We do that. We absolutely. That's part of our model, actually, is to invest in the funds, especially early and emerging female fund managers who are managing portfolios that include female health companies, because that's an exceptional way of de-risking the space and showing the opportunities that are out there. So it helps our capital go farther that way.
I think one of the things that Wendy and I noticed after investing directly for over a decade was that if we were really going to participate in changing the system for how capital flows to female-founded companies, we were going to have to move our capital upstream. So if we can write checks and enable other women to write large checks, we're kind of tripling down. So an example of that would be, as Wendy mentioned, if we can invest in a venture capital fund, for instance, one called Amboy Street out of California, if we can enable that fund manager to use our funding to then invest in female-founded companies that then are starting companies that are delivering goods and services in the areas where we want more exposure, we've really tripled down.
And your latest investment is in Mila, a matchmaking solution for matching women with the right therapist. Is that correct?
Yep.
How does that work? Why did you find them so interesting?
So in our portfolios, we haven't done an investment in mental health until investing in Melee. And we found it interesting because it's an opportunity for us to engage in another highly stigmatized key health issue, mental health. So for us, it's dipping our toe in and seeing if we can learn from engaging with Melee. Of course, mental health is massively underserved and underaddressed and invested in. And what those founders had understood was that one of the biggest issues that we're failing, for instance, in Sweden, is that a person normally finds a therapist in one of two ways. Either they're assigned someone or they call friends and family and probably get one or two names. And so the industry standard metric is to ask how many of those relationships are still together after 3 sessions. And probably shouldn't quote me, but here we are. I think it's like between 50 and 75% of relationships have been discontinued after 3. But Melee, what they're doing is they're really hacking this matching system and developing an algorithm that matches women's profiles and what they're looking for together with therapist profiles and the kind of work that they want to do. And they're finding, I think it's less than 5% breakup rate after 3 sessions.
Yeah.
Wow.
Which makes the system more effective, both from a financial perspective and also from an individual perspective. You're going to get the care that you need faster. And the system then has the results they need to help the matching algorithm move forward and match more people more successfully.
And it's also a scalable solution, I suppose, that you can address people all over the world eventually.
Hopefully, yeah.
And help them. Yeah. Mm-hmm. And you also work with sexual pleasure as part of your mission and your portfolio. Why is this an important area?
It's important to understand that Wendy and I are most interested in the development perspective. So really scalable solutions that are relevant in a global scale. So if we sort of reframe it that way, the development space has really been selling sex with death and disease for a number of decades. So for instance, if you have sex, you'll get a disease or you'll become pregnant and drop out of school. But really, it's an opportunity to taking a pleasure-based, sex-positive approach to meet people where they are. Most of us choose to have sex because it feels good. So the question is, could it be by telling adolescents what they want to know, they actually remember what they need to know? And will we show a greater uptake of goods and services at local clinics, for instance? The evidence will be there. We actually supported an organization a few years ago called the Pleasure Project out of the UK. And we supported them to update a review article together with the World Health Organization, looking at the evidence across thousands of research papers. And they did indeed begin to show that taking a pleasure-based approach does result in better outcomes.
Yeah, pleasure is the missing link between informed decision-making and sexual wellness. So putting sexual pleasure at the forefront of educational conversations allows for more holistic understanding of sex in terms of love, communication, and consent, natural human desire, and safety and contraception. Female pleasure is consistently deprioritized in sexual encounters, and that encourages women to engage in unwanted sexual acts, and it exacerbates the larger scale gender inequalities. So we just feel that it's super important that we put pleasure first.
So it's about empowerment, basically.
Absolutely.
I mean, the evidence is going to show that it has a direct impact on not just health outcomes, but mental outcomes and economic outcomes.
Yeah. Reduction in STIs, HIV, it's amazing.
It's the smartest approach, but for some reason, it's, again, back to stigma. It's been so heavily stigmatized, especially with regards to women. It's underfunded.
And everything that's stigmatized, you do when nobody's watching in a way. Oh, that's wrong, because you always have sex when no one's watching.
It's topics that people don't want to discuss. And as a result of not discussing them, then they don't get funded because people are afraid to bring them up in the boardroom in the areas where decisions are being made on what programs to be funded. And then they also get dismissed around the dinner table or when in the doctor's office. So these are very, very important things to discuss, but it's just standard that we avoid talking about them. So our purpose is to normalize conversations.
Mainstream topics.
Include it. And then we become desensitized to it so we can discuss them more openly and more accurately.
Are you generally targeting any specific geographic regions in the world?
We're not. We've made investments in the US, Europe, Latin America, Central America, Asia, Africa. And that doesn't mean that we're big. It just means these are globally relevant topics. And as we all know, innovation pops up in different places.
So do you see any particular area or country where the sort of quotation mark femtech revolution is going faster and is more interesting?
Well, I think femtech in Europe and in the US is proceeding because there's a little bit more disposable income, but it doesn't mean that they're not as of interest across the whole globe. So there might be more capital that's coming into the marketplace, but I think interest is equal.
I mean, I think Oki's a really good example, right?
Yeah, Oki's a great example. Oki is a UNICEF app that we provided funds to. We were a donor into Oki, and it's a open source library, basically an encyclopedia of puberty in everybody's pocket. It's available both on the App Store and on Google Play. It was written by girls for girls. It's in multiple languages across the country. It's lightweight, can work on any phone, and we're actively trying to promote it so it gets spread out.
How do you spell it?
OKY.
OKY. Okay.
Yeah, and any organization that partners with UNICEF and works on Oki to make it accessible in a local context, if they put that library back into the open source, it's available for the next organization. And the only definition is that we don't make a profit from it. You don't use it behind a paywall.
Yeah. So my daughter can download it.
Your
today.
daughter can download it. My daughter uses it. Right. It's a gamified period tracking, but it's the access to information and the encyclopedia of information that's available, scientifically proven information. And they actually used it in Mongolia, during COVID to distribute information across the community about precautions and treatments for COVID-19.
I also wanted to add, to your question about geography. Another project that we've engaged with is with a UK organization called D&AD, stands for Design and Art Direction. And I think, most of us haven't heard of D&AD before because we don't work in design. But if you do, it's kind of like the Oscar Award for professional designers. If you win one of these awards, the Black Pencil Award, you put it on your resume. They also happen to have a competition called the New Blood Awards. Has nothing to do with menstruation, for young professionals and students. And in that instance, there are 18 different companies that write a design brief or a challenge that young professionals and students can answer as a way to gain experience. Sometimes it's used as part of the curriculum, and then they can have something for their portfolio. So we put out a brief together with McKinsey Design a few years ago, challenging the audience to address global menstrual stigma or breaking global period stigma. And of course, we have no idea where these answers or submissions are going to come from. Well, we had over 30,000 individuals engage in our competition and many hundred submissions from over 117 countries where there was interest in really addressing this issue. The last 3 years, we've put out briefs for closing the pleasure gap, rebranding menopause, last year designing at the intersection of sexual reproductive health and rights and climate, and this year in partnership with Hey Jane, an abortion company, we are challenging the audience to establish or rebrand abortion as healthcare.
And it's a brilliant way to engage youth and also change the way they're thinking. So we can really start mainstreaming these subjects. And it's really cool because around the table, when the entries get submitted and it gets to the competition part, we're sitting around the table with design directors of major companies. So we're infiltrating their boardrooms as well because they're participating in discussions that are relevant, but they've never really considered before.
Interesting. You mentioned menopause. I think menopause and hormones, that should be the next research frontier, I think.
I think there are opportunities across the board when it comes to women's health with so little funding. We really haven't been studying the female body. But yes, I agree. Menopause, tons of opportunity. Also abortion, also contraceptives, also endometriosis, menstruation. I mean, we could just go on and on.
Because usually when we talk about global development and the future, for example, Melinda Gates' book.
The Moment of Lift?
Yeah, exactly. Yeah, in Melinda Gates' book, The Moment of Lift, in Swedish, it's Kvinnor förändrar världen, women change the world. She talks a lot about the importance of helping girls with education and escaping poverty. But menstruation is not a big part of that. What is the potential here? I mean, why is it so important to see the whole picture of empowering girls?
Girls are part of what leads the world, right?
Yeah.
And so empowering girls to complete and get a better education, to be more participatory in the workforce, to be more available and have the self-empowerment and the body knowledge, it's something that benefits all of society. And I think that's what Melinda Gates is getting to, even if she hasn't called out menstruation. But that's one of the reasons why we doubled down on menstruation, because we see it as such a fantastic opportunity that lies at the intersections of all these things that we're working towards. And yet, because it's not called out, it gets forgotten, which is why it's such an incredible opportunity. Because when it is included in programs, your programs are more effective. We know that we can increase school attendance, and we know that we can improve opportunity in the workforce, and we know that we can improve individuals' body knowledge and body autonomy when they understand how their bodies work. And that includes understanding the biological functions of menstruation. So what we're asking for is for people to apply what we're calling a menstrual lens and really consider menstruation in the programmatic funding that they're already spending, because you're going to be more effective and reach your goals more effectively and sooner.
Yeah, I like that you used the word body literacy as well.
Yeah.
Is that a sort of underlying philosophy of your work?
Well, so many girls get their first period without understanding what's happening. And imagine the fear that would hit a young girl who suddenly starts bleeding one day and she has cramps and she has pain and she doesn't know if she's dying. She's never heard this happening before. She doesn't know who to turn to because she's embarrassed, and maybe she's at school or stained her clothing and people are laughing at her. It creates an immediate situation where you're at odds with your body. It's trauma. And all it takes is a biology lesson and a little bit of understanding and preparedness. That's the thing that kills me all the time. It's such a simple conversation to have, and such a way that we can be changing the way girls interact with their bodies for everybody's betterment.
I usually ask, what is your best tip for making the world a better place in the future?
Find a partner.
Get started. I think that it was that question that really spurred me to get started, and probably you before we met. It was this challenge that a well-known philanthropist put out and basically said, what would the world look like if we all spent a couple hours a week just addressing or thinking or problem solving around some of the world's biggest inequities? And the challenge came with the realization that this could really be the privilege of a lifetime. And it wasn't dependent on capital, purely intention. And I think for me, and through this partnership with Wendy, I do feel like it will be one of my life's greatest privileges and also pleasures to really hook into purpose.
But for me, that happened through working collaboratively. Because I could have been sitting at home alone and doing these things, and my money wouldn't have gone half as far, my energy would have run out, and I wouldn't have seen the opportunities that working in a collaboration really create. So I would ask others or suggest to others that they try to find like-minded people. And there's many organizations offering to put people together philanthropically, the same ideas. There's tools available on the internet so you can learn some of these skills. It's not actually a skill. It's just a matter, as Cristina said, getting started. But it's so much better, and you go so much farther when you're a team.
And I think one of the conversations that we need to have in Sweden specifically is around philanthropy. I don't see much of it happening. I know there's plenty of interest in, let's say, making the world a better place. There's definitely plenty of capital, but for some reason there haven't been that many role models in the philanthropic space. And I think a misunderstanding that philanthropy maybe is slow and not necessarily so smart. But I think in my experience, working with Wendy over the last decade, we've really realized that philanthropy is where real innovation can happen, right? It's the most risk-tolerant capital. I mean, as far as financing is concerned, it's a spectrum. Philanthropy just happens to be at one end of it. But philanthropy has the opportunity to de-risk and innovate in ways that other capital just can't tolerate. So in Sweden, how do we unlock more of that?
Yeah, definitely. Have any good reading tips or podcast tips?
We do have some tips. Recently, a woman that we know quite well, Ruth Shaber, has published a book called The XX Edge, What It Means and the Power of Applying a Gender Lens.
I like Invisible Women, but it was a description of where women don't exist in economics and why that is and why that needs to change.
Caroline Perez?
Yeah.
Could that be her?
It's actually really funny. We're very well written, a lot of data, but it's a good read too. One of my other favorite reads right now is Manifesto for a Moral Revolution by Jacqueline Novogratz. She's an amazing change maker. She founded Acumen over 20 years ago and really has been defining the possibilities of the impact investing can do globally. I've just started Donut Economics by Kate Raworth, which is an interesting way of tackling economics from a different perspective, an inclusive perspective.
Yeah.
And a podcast that I've listened to recently was The Lie That Binds. Absolutely. Which is about abortion, safe access to abortion, and how it's changed in the American political system over time from being a non-event and a non-question to the politically motivated position where it's at right now. That was a real eye-opener.
The Lie That Binds.
The Lie That Binds.
.com. Okay.
Yeah. It was a book before it was a podcast, so you can also find it there. Yeah.
Elise Hogue. Ellie Langford. Yeah. Okay. Perfect. Great tips. Who do you think I should interview?
Well, I'd say Jacqueline Novogratz. Yeah. Next time she's in town. Yep. Joe Enzor. Yep. Would be a very interesting person you could speak to. Well, you should definitely have Mila on the podcast. Yeah.
Where are they based?
Gothenburg.
Okay.
We can make that happen. Mind blank. I'm thinking of Rebecca Gompertz and... Oh, yes, absolutely. We've got two people for you. So it turns out that the current state of medication abortion, the Combi Pack, was more or less developed down the street from here at Karolinska Institutet. There's an incredible researcher named Cristina Ljungberg Danielson who's been working on this question for over 30 years. She was actually one of the original research associates on that Combi Pack research. You know, in Sweden today, I think it's around 95% of abortions are medication abortions. I mean, it's really revolutionized the space. And of course, it's going to be extremely relevant as we try to give more access globally because it can be self-administered at home telemedicine. So now, together with an incredible PhD abortion provider activist in Holland named Rebecca Gompertz, they are teaming together to show that mifepristone can be used as an innovative contraceptive, which will basically lead to it being less regulated and more available for medication abortion in places where it's been less accessible.
And dangerous.
Yeah. And it is right now, yeah.
Let's wrap this up. Thank you so much, Cristina Ljungberg and Wendy Anderson, for joining here from Framtiden.
Thank you for having us. It's been really fun to talk to you. Great to be here.
Check out thecaseforher.com. Read more about the portfolios and collaborations and how you work, basically.
And you can find us on Instagram and LinkedIn, too.
Great.
And now on podcasts.
Wherever you like. All right. Thank you so much for coming here. You work just a few blocks from here.
We do.
Yeah. Nice. Brief stroll back home.
That's how it was.
Okay, good. My name is Christian von Essen, and herframtiden.se is where you can find more information about all the podcast guests and my other projects with books and lectures and magazines and newsletters. Thank you so much for listening.